I'm going to go ahead and get us started. Just making sure that I am in fact recording. Great. Well, thank you all so much for joining this morning. Our webinar today is Navigating North Carolina's Rising Temperatures, Understanding and Addressing the Health Risks of Heat. My name is Rebecca Ward, and I am a postdoctoral research scholar at North Carolina State University and with the NOAA Carolinas Climate Adaptation Partnership. And I'll be hosting and moderating today's webinar. Just a few administrative details as we get started. We do ask that you keep yourself muted throughout today's presentations, but do feel free to have your video on or off as you prefer. At the end of today's talks, we've scheduled some time for Q&A, and at that point, we welcome you to use Zoom's raise hand feature if you'd like to unmute yourself to ask a question. We also encourage you to type questions in the chat throughout all of our presentations today, and we'll aim to get to as many of those questions as we can. Additionally, like I mentioned, this webinar is being recorded, and the recording will be included in the upcoming Heat Action Plan Toolkit, which will be hosted on the North Carolina Office of Recovery and Resiliency's website. That toolkit release, which will be happening next week, will be shared through multiple channels, but one of the best ways to stay informed about that and this webinar recording and other resilience news is with the new NCORE Resilience newsletter. You can sign up by scanning the QR code on this slide, and we'll also drop the link in the chat as well. And you'll see this QR code a couple of times during today's talk. So if you missed it now, it's okay, it'll come back up. All right. Well, today's webinar has been made possible because we have so many partners who have been involved in the planning and the delivery and who we're trying to acknowledge with all the different logos on this slide. It's truly been a collaborative effort. We also want to acknowledge that all of our partners reside on the traditional homelands and gathering places of Indigenous peoples, and all of us share an ongoing responsibility to safeguard these lands and to respect the sovereignty of the tribes and Indigenous nations residing in North Carolina. And we also recognize the unnamed tribes that once oversaw these lands and have since relocated or been displaced. So for today's webinar, we have actually had this idea for almost a year. We held a workshop last summer in Cumberland County, and I know some of you on today's webinar were there, and we want to thank you again for participating in that. That workshop was with local government officials to share and collect feedback on a draft heat action plan template. And during that workshop, a request was elevated to have a recorded 101 type of training for local governments, community groups, and others involved in planning for and responding to heat to be able to use as an educational resource for learning about heat, for learning about health-related impacts of heat, as well as state and local activities in North Carolina. And so that's really what we've planned for today. We have a series of talks by a panel of experts, who I'm really excited to introduce in just a moment. And we'll explore North Carolina's changing temperatures, the dangers of extreme heat to human health, strategies for preventing heat-related illnesses, how communities in North Carolina are preparing, and how the state is helping. And so with that, I'm going to just jump right in to our first speaker, Kathy Dello. I'm going to hand over remote control so she can control the slides. And with that, Kathy.
I think I have control. I know it takes a little while. Good morning, everybody. It's good to have you here on this abnormally warm week in April. It feels a little bit more like June, so heat is top of mind for all of us. Now, I get sort of the easy job. I get to convince all of you that it's hot in North Carolina, and we know it's hot, y'all. And I'm going to just lay out a brief climate perspective to set my wonderful colleagues up for their next presentations. But yes, North Carolina summer days are hot. They have been hot. They will be hot. They will be hot in the future. This is something that we all know. We have our sweet tea. We like sitting out on our porches. You know, when it's July and August, we slow down a little bit. But we can measure this heat across the entire state. And we know that parts of the state are a little bit hotter than others, especially down in Southern North Carolina, the Sand Hills, up here in the Triangle where we are at the State Climate Office. And it's a little bit cooler in the mountains, but it still gets hot up there. Now, this is a map of average days per year with maximum temperatures over 90. And 90 isn't anything super extreme. In July and August, our average high temperatures are in the high 80s, low 90s, but we use this 90 as kind of a threshold for thinking of when the heat starts to get a little bit more than kind of your daily plan. But we're really seeing the nights warm up here in North Carolina. And I picked out the Raleigh station to show you nights over 75 degrees Fahrenheit over the historical record. So we've been recording temperatures at Raleigh Airport back to the 40s, and we have a really consistent record there. And you can see from this graph, which you can generate at the State Climate Office, is that it was really rare to have even a year with a night over 75 in the 40s, 50s, 60s. You get to 1981, and some of you on this call likely remember that year where we had 11 days with temperatures over 75 at night. And that was a generational event. I'm sure folks are like, wow, this is really unreal. This hasn't happened before. And it didn't happen again for a few decades. But you can see in the recent years, in the past 15 years, we've had a number of years with even more nights with over 75 degrees Fahrenheit. So we sometimes forget about the nighttime heat, but it's really a daytime and nighttime thing that we're thinking about. But not all heat is record, and sometimes it's just relentless. So I pulled out the temperatures from 2023 using a tool from the State Climate Office. And what we do here is we show you every high temperature at Raleigh Airport. The top line is September through June, and we color code it based on, was it in the 60s, 70s, 80s, 90s, or 100s. And in early September, I know I can remember this very well. We had that run of record high temperatures, including those pair of 102 temperatures early in the month. Only one of those days was a record, but that was a time when the heat was record. So I like to equate it to maybe you have 3 or 4 really, really busy days at work. It is sun up to sundown, and you've got a ton of family responsibilities, and it's going to last for 3 or 4 days, but there's an end in sight. But 2023 summer was also relentless. We were over 90 for a lot of days last summer. So crossing that threshold that I talked about at the beginning. And I like to equate that to those times at work where you're just a little bit more busy and it just keeps going and going and going. And I know a lot of folks can relate to that on this call. So thank you for joining us. But you can also feel the stress from that when the temperatures are elevated for a number of days in the summer, and I'm just showing you the daytime, but they were in nighttime as well. This also stresses people, plants, and animals. But heat isn't felt equally in all places or by all people. And we all have our favorite heat index or calculation. We have wet bulb globe temperature. I know there are a number of fans on this call. We measure it here at the State Climate Office, and we provide a map, as you see on the left. This is late July of last year. We can measure urban heat islands and display the heat index. And there's so many different ways that we can talk about heat, and we can measure it. But we know that it's not distributed equally across the state, but that doesn't mean the people in the mountains aren't experiencing heat-related illness or stress, which my colleagues will talk about. And that we know even within our neighborhoods, heat can vary from person to place to dwelling. So something to think about as this webinar goes on. But talking about the future, there will be more hot days in the future. So I said it's been hot, it will be hot, it will continue to be hot. This is something that we know as we continue to add heat-trapping gases to the planet. This is a figure from the last National Climate Assessment, which came out in November 2023, and I was an author on it. And it's looking at the future change in days over 95 degrees Fahrenheit. You can click any county that you want. I picked Mecklenburg for our friends in Charlotte. And this shows for global warming levels. So essentially the planet hits 2 degrees Celsius. There will be 19 more days over 95 in Mecklenburg County compared to the historical. So something really, really different than we're used to now. So we have to start preparing. And as I move out of my section and transfer to Ashley Ward, we have increasing heat and we have compounding issues. I talked mostly about the daytime temperatures, but I mentioned the nighttime temperatures. And I wanted to pull this figure from the Southeast chapter of the National Climate Assessment that shows blackouts affecting more than 1,000 residents for more than 1 hour. So North Carolina is second from the right. And the warm season is May through September. And we have some of the highest incidents of warm season blackouts in the Southeast. And this is a problem because of those daytime and nighttime temperatures, those relentless 90s, those warm nights that we weren't seeing 50 years ago that we're seeing now. If you don't have access to cooling in other places, or you're physiologically stressed, or you've been working outside, this is a problem. And these issues compound. It's not just the heat, it's always heat and something else. So thank you for your attention. I look forward to your questions, and I'll turn it back over to Rebecca.
Thank you, Kathy. And I also want to apologize that I just handed it to you without introducing that you are the North Carolina State Climatologist and the Director of the State Climate Office, and just a wealth of experience and expertise. So thank you so much. I'm going to hand this now to Ashley Ward, who is the Director of the Duke University Heat Policy Innovation Hub. Ashley, please feel free to, let me mute myself and then you can take it away. Hold on.
Thanks so much, Rebecca. I appreciate it. And thank you to everyone for taking time out of your busy day to be here. Thrilled to be with everybody today, and want to talk a little bit about when we think about climate, when we think about heat vulnerability in North Carolina, what does that look like exactly? So let's see, I think it's going to advance. Thank you. So it's probably not a surprise to many of you, but it also may not be a well-known fact that heat kills more people than any other weather-related event. But to some of the points Kathy was making earlier too, heat is also responsible for considerable impacts on our communities. In the US, the estimated $100 billion in labor loss every year, more than $3 billion in ag loss, and $1 billion in healthcare costs. And so heat not only affects us individually and our health outcomes, but it also affects our communities and our broader health and well-being. And we know that temperatures are going to rise, and they're continuing to rise, and in certain specific ways, to Kathy's point about overnight temperatures. And so I want to talk a little bit about what we've understood about heat vulnerability and how that compares to the experiences that North Carolinians have. So typically, research on heat-related illness has focused very much on urban locations and on heat wave events, meaning what I would call acute events of heat wave. Those studies also typically looked at mortality studies, so thinking about who dies from heat. There are more and more studies, though, that do look at who gets sick or ill, illness and injury from heat. And those studies were largely concentrated in the Midwest portions of the US and the Southwest regions of the US. And what they showed was very high mortality and heat illness and injury among our aged populations over 65 and people who are very young, particularly when temperatures were unseasonably warm early in the year, like an unseasonably warm May. However, in North Carolina, we find a very different pattern for heat vulnerability. And as you can see from this map, the black stars represent urban counties or cities, and the shading represents the magnitude or the heat illness rates for those counties. And what you see is a concentration of heat illness rates largely in rural communities in North Carolina. And so there are a few distinctions between that information that I gave you earlier and what research shows about the experience for people in North Carolina. The first is that heat-related illness is not just an urban phenomena or something that happens or is significant in urban populations, but in fact, in rural locations, in some cases, we see heat-related illness rates 7 to 10 times greater in rural locations than what we see in urban locations. We also see a very heavy burden of heat illness and injury in North Carolina. Certainly death, mortality is an important issue, but we have an enormous issue with emergency department visits. As our friends at the Department of Health and Human Services, if you don't get their weekly heat update, you should get one. I look forward to seeing that every week. But really specifically, the demographics in North Carolina, and my guess is throughout much of the Southeast, looks quite differently than it does in some of those traditional studies. A majority of our emergency department visits actually occur in men and from ages 18 to 45. But we've also noted significant vulnerabilities among pregnant women. I also want to make a distinction between indoor and outdoor workers in rural areas. We commonly think about occupational exposure and risk for farm workers, and that's certainly the case. But for those of you who live in rural North Carolina, you know that as you drive out through rural North Carolina, there are an awful lot of manufacturing plants in rural North Carolina. And so we have, also, in addition to an outdoor worker vulnerability in rural areas, we also have indoor heat vulnerability. Some of the indoor temperatures of these manufacturing facilities exceed 90 degrees on a regular basis. Also in North Carolina, and like everywhere, the challenges with the unhoused populations, particularly around mortality, and the interactions between heat and those who are drug addicted. These continue to be populations that are of particularly high risk in North Carolina and elsewhere in the U.S. But I also want to raise the issue of seasonality and time of day. And this is something that Kathy was pointing to earlier. In North Carolina, instead of having a lot of vulnerability early in the season, which happens in many places throughout the country, we actually see some of our highest rates of ED visits in July and August. So thinking about, it's not just about early unexpected heat waves, right? It's really about chronic heat that's happening through the entire heat season. And this is a really important point for those of you who are working with communities. As far as time of day, to Kathy's point, we're seeing more and more associations with overnight temperatures. And so I just wanted to see if I can advance my slides. Oh, here we go. So this is from an earlier study that shows the distribution of emergency department visits. You see the blue and the green are rural areas, and you see that spike in the Middle Ages there. Certainly it kind of dips and then comes back with our aged population. But there's absolutely a pattern for rural heat vulnerability in North Carolina that is different than what we would have understood and from other studies. And then also the trends. So this is like Kathy pulled from the Raleigh station. This is a query from the Fayetteville, North Carolina station looking at overnight temperatures of 75 degrees. And this is over the last 75 years, ending in 2017. So not going quite as far as Kathy's. And you can see in Fayetteville at that time, we were already quickly approaching in 2017, almost 30 days of overnight temperatures at 75 degrees. Now, these are particularly difficult because if you work outside or exposed to heat during the day, either through manufacturing work in the food service industry, outdoor work, construction, overnight temperatures, especially if you can't afford your air conditioner, don't have access to it, means that your body doesn't have time to recover from that heat exposure during the day. And it means you're more likely to be in crisis later in the week. But this is particularly a challenge for those that suffer from high energy burden. It isn't unusual to hear people talk about making the choice between running their air condition and buying groceries or medicine. And so these overnight temperatures really are an important aspect of the equation when we talk about heat vulnerability in North Carolina, and certainly compounded with power outages. As all of you know, if you live in North Carolina during the summer, we can have a thunderstorm that blows through and knocks out power. Power is usually restored to more densely populated urban populations before rural populations. And so what that means is rural communities can be without power for longer, and turning a nuisance event into something that can be quite dangerous. So thank you all. I appreciate your attendance today and happy to answer any questions.
Thank you so much, Ashley. Great. I'm going to now turn it over to Dr. Sarah Hatcher, who is the Climate and Health Program Lead with the North Carolina Division, DHHS Division of Public Health. Sarah, please feel free to take it away.
Great. So let me wait for this to catch up. Did the slide change? Sorry, Rebecca, are you seeing the slide change? Okay, there we go. Sorry about that, everyone. So good morning. As Rebecca mentioned, my name is Sarah Hatcher and I lead the NCDHHS Climate and Health Program. We are in the Occupational and Environmental Epidemiology branch of the Epidemiology section in the Division of Public Health. So the NCDHHS Climate and Health team aims to build community resilience against climate change and its impact on health. We've been funded by CDC since 2010, and historically our work has been focused in Eastern North Carolina, but we're now working towards expanding to additional parts of the state. The map on the right shows the counties in North Carolina where we currently work. We also work across NCDHHS and with other state agencies to support Executive Orders 80, 246, and 292. Our program operates 2 primary extreme heat initiatives during May 1st to September 30th each year. And first, our heat-related illness surveillance effort, which Ashley already mentioned, documents our weekly emergency department visits for heat-related illness for North Carolina overall, and in this year by region. We distribute this weekly report to our partners and post it to our website. The report aims to provide timely and actionable public health information for decision makers at the state and local levels. You can find these reports at the website listed here. And for this presentation, I'm going to focus primarily on our second extreme heat initiative, the Heat Health Alert System. We've been piloting this system since 2018 in a subset of counties in Eastern North Carolina. This year, due to a partnership with the North Carolina State Climate Office and the Duke Heat Policy Innovation Hub, we'll be expanding the system statewide. So let's walk through how the system will work this year. Users will sign up to receive alerts through a short online REDCap survey. The survey is available in English and in Spanish. The survey collects users' email addresses, identifies the counties they want to receive alerts for, and collects additional demographic information to help us understand who we're reaching through the system. Users are assigned to 1 or more regional listservs based on their responses to this survey. And during the heat season, we check the forecast for all 100 counties twice per week using an automated query that the State Climate Office helped us set up. The automated query checks the 3 or 4 day forecast for each county and compares the maximum heat index to the forecast for the regional heat index in the forecast to the regional health-based heat index threshold. And if a county's heat index is forecast to meet or exceed the threshold in the coming days, we send an alert via email to users who have signed up for alerts in that county's region. The alert also includes information about populations who are vulnerable to heat-related illness, how to prevent heat-related illness, and links to other helpful resources. Alert recipients can then use all of these resources to share alerts with their organizations and communities as appropriate. In the past, our partners have shared alerts using radio announcements, email, social media, and other channels. And at this website, you can sign up for the Heat Health Alert System. You can view heat-related illness surveillance reports. I saw some questions in the chat about that. And you can access other resources. The social media and heat alert messaging toolkit, as well as updated digital and printable heat health educational materials, will be available at this website in the coming weeks. And I want to take the last few seconds to just thank my team, Autumn Locklear, Courtney Williams, and Giovanna Pretty for their work developing these tools and resources. I also want to thank our branch head, Virginia Guidry, and our branch operations manager, Alvarina Clay, for their support. And finally, I want to note that we're grateful to the State Climate Office and the Duke University Heat Policy Innovation Hub for the technical expertise in setting up the automated query and identifying heat index thresholds for the system. And of course, we want to thank NCORE for hosting and inviting us to present today. Thanks.
Thank you, Sarah. Over here, there we go. Next, I'm going to hand it over to Andrea Webster, the Resilience Policy Advisor for the North Carolina Office of Recovery and Resiliency. And let me find you, Andrea. Okay, me meet myself, and it is all yours.
All right, thanks, Rebecca. So my name is Andrea Webster. As Rebecca said, I work for NCORE, the North Carolina Office of Recovery and Resiliency. Our office administers $1 billion in disaster recovery funds from multiple federally declared disasters. I'm part of the resilience team at NCORE. Our team started work in around 2019, and we are focusing on helping communities prepare for the impacts of climate change before disasters hit. So of course, we're talking about understanding and preparing for extreme heat today. We also work a lot with other hazards presented by climate change. So, as Rebecca was saying early in our presentation today, we know that local governments have plans in place for when a hurricane is in the forecast or when an ice storm is coming, but most local governments don't have a plan in place for when a heat wave is forecasted. So that's the purpose of this soon to be released toolkit. It's to help communities understand the dangers of extreme heat and to identify the specific actions they can take before, during, and after extreme heat. We're going to release the Heat Action Plan Toolkit April 22nd on Earth Day, so that's this coming Monday. If you want to receive an email in your inbox, I encourage you to subscribe to the NCORE e-newsletter. You can do so here using the QR code. I also have this QR code on all of my slides, so over the next 5 to 7 minutes, you'll have a chance to take a snapshot of that and subscribe, so no rush. And I believe we can also post the subscription link in the chat again later today. So over the next few slides, I want to talk to you about what's included in the toolkit. So first, we have introductory information. It's a lot of the content we're covering on this webinar today. So we're talking about why extreme heat preparedness is important. We're talking about heat-related illnesses and describing them and what they are and how to recognize them. We also provide some funding opportunities that are targeted towards extreme heat. So hopefully this will be a lot of information to get you started. Now, the largest component of the Heat Action Plan Toolkit is the Heat Action Plan template. So this is a Word document where you can just fill in your jurisdiction's name. You can also pick from 31 draft actions that we have spread across 3 categories. The first category is during the heat season, so approximately between May and September, depending on where you live in North Carolina. We also have actions drafted for you for when extreme heat event is forecasted. So it's coming, what are you supposed to do now? How do you prepare your residents? We have several of those types of actions for that category. And then finally, we have those long-term management strategies. So a few examples of these actions are launching a cooling center program or developing a neighbor check-in program. We also have some instructions and action description for incorporating heat into your hazard mitigation plan. A lot of that content was developed by Ashley Ward at the Heat Policy Innovation Hub and her team. And then additionally, within each action, the template provides a description of what the action is, prompts for additional local details, such as who are your community partners, what's the implementation timeline, and we also provide information on how to get you started on implementation. In the appendices of the Heat Action Plan Toolkit, we have a series of technical instructions. So we provide step-by-step instructions for you to identify who in your jurisdiction has a higher risk from heat, why their risk is higher, and where they live. So this information can help you design programs to help people who need it where they live. So that information is going to be really important for you. We also provide some instructions on how to identify your local temperature thresholds for what is considered extreme heat. So Sarah just talked a lot about receiving alerts for when these thresholds are hit. So I want to talk a little bit about what a threshold is. So the temperature at which humans begin to experience negative health impacts is different for everyone. These temperatures can vary by what temperature your body's used to, how old you are, whether you have pre-existing health conditions, as Ashley mentioned, whether you're pregnant or not, and also medications taken. So they can really vary person to person. But community members and specifically local leaders need a point at which to start preparing their communities for extreme heat. And so scientists and state and federal agencies typically identify what is called a heat threshold, and it's usually tied to geographic areas with similar climates. So this ensures that guidelines that policymakers and health departments are putting out are tailored to local conditions and residents' needs. And although everyone experiences heat differently, it's really helpful to have specific temperatures identified to help us define what is extreme heat or what is an extreme heat event. And as I said before, that we call these points heat thresholds. So currently the State Climate Office and the Heat Policy Innovation Hub, so Kathy's team and Ashley's team, are developing thresholds for multi-county regions across the state. So I believe we've divided the state into 7 different regions so that we have very specific thresholds depending on where you live. And then, of course, these are the exact same thresholds that Sarah and her team are using at the Department of Health and Human Services for the heat health alert system. So these thresholds will be available in the State Climate Office website. They'll be linked in the toolkit, and we'll have specific instructions on how to use them and how to identify them for where you live. And these thresholds really do acknowledge that residents living in the mountains have a very different experience with heat, and they have different thresholds than people living in the Piedmont or along the coast. So we're really happy to release those next week. And finally, in North Carolina, temperatures are typically highest in the month of May to September. That's what we call the heat season. And the toolkit provides instructions for how to look at your jurisdiction's average temperatures to determine the specific dates for your heat season in your community. And finally, the last part of the toolkit is a set of supplemental materials. So we have sample checklists for cooling centers and heat relief supplies. We have sample community surveys if you want to talk to people about how they experience heat and how they prefer to cool themselves down, where they go, whether they stay at home. We also have sample messaging, including a hotline script if you launch a heat relief hotline. We have press release templates and social media posts, both in English and in Spanish. We have sample graphics and infographics for communicating with residents of high-risk groups. And then, of course, we have a recording of this webinar. So you'll be able to come back to this very easily. And with that, I'll thank all of my colleagues for helping make this happen and remind you to subscribe to our e-newsletter using that QR code in the bottom corner so that you'll know exactly when you can access the Heat Action Plan Toolkit on April 22nd. So thank you so much.
Thanks, Andrea. I am so excited about that toolkit release on Monday. It's been a long journey to get here.
Agreed. And I should mention too that Rebecca has spent so much time drafting this content. So we really want to thank you for making this happen.
It was a pleasure. All right, next up, we have our final speaker for today, last but definitely not least, Ann Lowry, the Environmental Health Director for the Chatham County Public Health Department. Let me hand control over to you, Ann, and then you can take. All right, I'm trying to hand remote control and I'm trying to find you. Give me a second. I don't know why you're not popping up.
It looks like she may have been. Oh,
yeah, you're back. Okay, there you go. You have control now.
All right. Thank you, Rebecca. Thank you all for joining us today. I'm the last bit, but I'm the local part of this presentation. Having all these wonderful experts that you've heard from today and the resources, including the toolkit that Andrea just mentioned, the Chatham County Heat Action Plan development process was easier, but there's still a lot of local work that has to be done to finalize a plan. During the presentation, I will walk through each step with you. Maybe you'll be able to see the slides. Here we go. All right. So the steps involved convening partners, identifying vulnerabilities, developing lists of resources, engaging the community in the response, and finally the plan, do, act, and check. First, convening our partners. Our primary partner in the heat action plan, as with most responses in Chatham County, started with emergency management. We also worked with schools, libraries, parks and recreation, and our Chatham County Climate Action Committee, which is a Board of Commissioners advisory group. Next, we wanted to identify our vulnerabilities. Each community will need to identify their own primary vulnerabilities to help focus messaging and education during the heat season. Chatham County's primary vulnerabilities were lower income communities and our older population. Chatham County's older population makes up about 25% of our community in comparison to across the county, across the state and the country is about 16%. So we have a high percentage of older population. Other communities might identify outdoor farm workers in crop farming communities, urban heat islands, and unhoused population. We also identified language as a barrier to our response. And so we also focus on providing all of our materials in English and in Spanish. Once we identified the vulnerabilities, we then started looking at our resources and what we had for extreme heat. Number one is what Sarah talked about, the heat health alerts is a state resource. We also have our libraries for cooling centers. We have community groups that are willing to set up emergency shelters for extended periods of heat overnight. We have a local agency who have box fan distributions, electric bill assistance programs, and of course, our public information officers at the health department, the county level, and our local municipalities. And then we're not done yet. We then contact other agencies. Once we kind of got a draft plan, we contacted other agencies and community groups that focus on our populations with vulnerabilities and other barriers. Those groups included Hispanic Liaison, long-term cares, retirement communities, community-based organizations, and faith-based organizations. And then finally, as with all plans, we plan, do, act, and check. This will be our first year with our heat action plan, so we expect to see some changes and some improvements as we use the plan. The one comment that I got from nearly everyone who reviewed our draft was, don't forget about planning for pets and livestock. And that is it. Thank you all.
Thank you, Anne. And that's actually one bit of feedback that we also got on the heat action plan toolkit was trying to find ways to incorporate reminders about pets and livestock as well. Great. Well, thank you all so much for your presentations. I also want to just applaud all of our speakers for just the diversity of experience and things they were able to share, and also for staying in their short allotted time. That never happens unless we have such great speakers like we do today. So what we're going to do now is transition to answering any questions that have come in through the chat. Like I said, if you would like to ask a question, like to unmute yourself and ask a question, please just raise your hand through Zoom, and we'll call on you. So I'm scrolling through the chat now to identify our first question. So one person early on, I think that we've hit this a few times, but maybe we can just reiterate here, is how would I sign up for the heat update? And I think that this was in reference to the heat alerts from Sarah.
Yes, you can sign up at our website, which I've put in the chat. And I can put it in the chat again just to refresh that. But it's live there. And you can also view our heat-related illness surveillance reports there when they're released weekly. I do want to note that the heat-related illness surveillance reports that you see there are a different format from what we'll be releasing this year. In the past, we've had only statewide reports. In this year, where the numbers allow, we'll be providing regional reports as well.
Thank you, Sarah. We also had a question come in that I saw was already answered in the chat, but I'll just share, was asking where to find the overnight trend data that was shared in Kathy's presentation and also in Ashley's presentation. So Kathy already answered it in the chat, but just to say that These products are available from the State Climate Office's website. Lots of really great tools there. Kathy, I don't know if there's anything else you want to add in response to that question.
Yeah, so there was another question that asked if we're sending out slides. We'll send out slides and then a compendium of resources that we talked about and maybe some tips and tricks for using the tools as well. So stay tuned for that.
Great. This is my first time. I don't know if y'all knew I couldn't really control my screen for most of this, so I'm just now reading all of the chats that came in. So one person had asked, and I'll pose this to any of our panelists if you have an answer, is the U.S. Department of Labor adopting heat standards for outdoor workers, or maybe opting in? Does anybody know or have any insights to share about that?
Andrea, I'm welcome to let you go first.
Well, I think you had a great response in the chat, so go for it.
So right now, the policy in North Carolina is to rely upon the general duty clause, which says that that employers need to provide a safe working environment. The challenge on that clause is that it is difficult to enforce. So that definition is intentionally vague, which makes it difficult for any redress. But after the worker death last year, September 5th, there's been renewed calls for North Carolina to adopt clarity, at the very least, clarity for worker protections in North Carolina. There is currently a race for the Labor Commissioner of North Carolina, and this has been quite a big topic in that race. I suspect that the answer to that question will depend upon who is ultimately elected as the Labor Commissioner in North Carolina, as they have different opinions about how that should be carried out in North Carolina. I should also point out that at the federal level, in many cases, states look to the federal OSHA in order to set the floor standard for what the states follow. And federal OSHA is currently going through a rulemaking process that will increase worker protections at the federal level. And so we may see that happen, and then that would precipitate changes at state level as well. So right now, I am not aware of any other rulemaking changes underway at the state level for worker protections due to heat, as there is a tendency right now to still rely upon the general duty clause.
Thank you for that very detailed reply, Ashley. We had another question come in about efforts to increase emergency department and other healthcare visits to capture all heat-related healthcare encounters. I'm going to hand this to Sarah to answer that.
Yeah, so our data source for emergency department syndromic surveillance in the state is NC Detect. That includes all civilian emergency departments in North Carolina, so it's pretty comprehensive when it comes to emergency departments. For primary care clinics and urgent cares, the data are not as consistent. And I think there have been efforts to include those, but it's not a requirement. And so I'd be happy to talk to our colleagues at NC Detect to ask about the status of including primary care clinics and urgent cares in the statewide syndromic surveillance system, and maybe we can include that in a Q&A afterwards.
I see that Ginger has raised her hand. Ginger, if you'd like to unmute yourself and ask a question.
Yeah, hi, Ashley. Dr. Hatcher, I just wanted to follow up with you about that question about the dashboard, because there's the NEMIS dashboard and then NC Detect, and it's really different information on
Yes.
by county, right? So I'm just curious if the toolkit or the guidance is moving to try to help get some sort of standardization with people coding, and then maybe eventually coding out of primary care, prenatal health care, other cardiovascular cardiologist office, so that we start layering the cumulative risk that people might experience with heat exposure versus just ED visit, because we know there's till it's a heat stroke, people aren't going to go. There's some people who will not access ED services. Thank you.
Yeah, so you've made a great point there. Emergency department visits are the tip of the iceberg. You and I know that we're not going to go to the emergency department for just anything. And the most frequent diagnosis code that we see in our emergency department visit data consistently is heat exhaustion, and that is, beyond the heat cramps or the early signs of heat-related illness. In terms of emergency medical services call data, the NEMSIS dashboard is another federally available resource. We've just begun exploring how the EMS data in NC Detect compare to the emergency department visit data. So I can't comment with confidence on the alignment there, but it is something that we're exploring. But I will say that there is a difference between emergency medical services call data and emergency department visit data, and we rely right now on emergency department visit data.
Great. Thank you for those questions and for also those great responses, Sarah. So I think this question was for Anne, asking about the CBO. I think that was referenced as community-based organizations. And is that the same as the communities organizations active in disaster?
No, that was being used as a general term, just any community-based organization. But I plan on looking up the active in disaster community-based organizations as well.
Thank you. We had a question come in from Julia asking about what data sources would we suggest using when examining risk and vulnerability for local communities with regards to extreme heat, any spatial data or GIS data for projections. So I can just briefly, and then I'll throw this to the rest of the panelists, is that within the Heat Action Plan Toolkit, we do have some specific suggestions for resources to use, like GIS tools to use to explore what your local community's risk and vulnerability might be, to try to find some of those things, like where are the populations in your county or jurisdiction that might have higher risk from extreme heat, cross-referencing against some of those known factors that might increase that risk. Anyone else want to add anything?
Yeah, I'll add in something on the projections. So I could have spent the entire webinar talking about projections and they wouldn't let me, which was good. We needed to hear from everybody else, but there are a few different approaches. You can do a first pass through the data that was released with the National Climate Assessment. There's the NCA5 Atlas. And if you ever want to send me an email, I can help walk you through it. It's sometimes a little bit difficult to navigate, but also want to put a plug in for NCOR's Resilience Exchange. There will be some climate projections for local and county governments on that website in the next few months. So that's also a good first pass. And then if you want to dig down to very neighborhood scale stuff, it would require a little bit more computing and research power, but we're always open to the conversation in the State Climate Office.
And I'll add that when we send out resources following this, we'll include some links to kind of help navigate and get started looking through that. Sarah, did you want to add anything?
Yeah, I just want to briefly mention, sort of keep an eye on our website. I'll put the link to the main website, where our program is required to also develop a climate impact compendium, which will provide local level climate hazard and health vulnerability data for North Carolina through that tool. It won't be available until later this year, definitely after the Resilience Exchange is available, but it'll be posted on our website when it is. And also, I'm sorry, the Environmental Health Data Dashboard is another resource that's available through the branch where the Climate and Health Program is.
And I think this is a really great question. So thanks for posing it. And I think this could be a good topic for a future webinar, because there's a lot of resources out there, and depending on your GIS capabilities, some are easier than others. And so we can go through a couple, and we should definitely try to do that in the future for you all.
I'm seeing a couple of questions about education. So educational tools for bringing awareness to children and pets left in cars during the heat, as well as, are there any heat health related education geared specifically towards school age children to have in schools. So in developing the Heat Action Plan Toolkit, we did identify a couple of resources. The CDC has a really fun, well, if you like workbooks, it's really fun for youth, like a coloring kind of fill in the answer workbook that we could link to as well. There's a couple of like suggestions for programs that we've included in the Heat Action Plan Toolkit. I'm blanking on any like specific program, but there might be some that are occurring at either the state level or in local places that are like specifically around heat. But mostly what I've seen is there's a lot of really great infographics and messaging, like communication templates from CDC, the National Weather Service, around how to like remember, don't ever leave a pet in a car, don't ever leave a child in a car, to try to increase that awareness. And then I see a question as well, acknowledging that this might be a little bit out of the scope, but maybe we can talk about a little bit, is building code, zoning, or other mechanisms to reduce heat exposure, examples of heat considerations in these. I do know that in the toolkit, we've included some examples of like recommendations to do at, say, like a individual homeowner or like resident level for ways that you can try to like weatherize your home to increase your resilience to heat, to keep things cooler, shadier inside. I don't know if there are, I don't know the answer to the building codes question.
I think for the building codes question, that is typically something that county commissioners are, typically the front line there. And, you can petition your county commissioners to set standards. That's one really important thing to do. There are also, for example, Durham County has a sustainability officer and was able to secure grants for tree planting campaigns. And I know other counties have done the same. I think there's another question, sort of combining that question, Rebecca, with the one on justifying canopy coverage for sidewalks and multi-use paths. But the current administration also has a fairly significant grant out to secure money for local governments to be able to initiate those tree planting campaigns. And while the research is sparse, if you're looking for benefit cost analysis on those kinds of nature-based solutions, there is actually a formula to do so for tree planting. So that's about the only one available, but I'm happy to follow up with you and send you that information if you're trying to advocate for your county commissioners to help understand what the impact of those things would be. Outside of that, I think there's some sparse information out there on cool roofing and cool pavements that people are starting to develop a more robust, but one of the big challenges around heat work is the lack of standardization around benefit cost analysis, which is what you'll need to get your local government on board with passing those kinds of building codes and restrictions. And it faces some pretty hefty headwinds.
Thank you so much, Ashley. I think that sort of addresses all the questions that came in. I did want to just flag this is only for a few specific locations, but recently the heat mapping that was done in Raleigh and Durham, and I think it was also done in Asheville, Kathy, there's some really great maps that have come out of that. So, obviously those are only a few locations, but really high resolution to show areas that are hotter at different times of the day. And they're just a really great resource for those specific locations, but also I think just to convey the message that we know that heat is not evenly distributed across our landscapes, even over very short distances. And Charlotte just got awarded yesterday. That's so exciting. Great. I also see that Gail did a quick plug for the National Weather Service forecast and outlook information. Yes, definitely really important, especially as we start to experience in the next couple of weeks more of these upper 80s, flirting with 90s degree days. Great. Any additional questions in the chat? If I didn't miss any question, or anyone who would like to raise their hand to ask a question? Ginger.
Hey, I have another question. Do you all now, or will you have in the future, capacity to run correlation between high heat days and nights and other things like child abuse reports coming in, community-based violence, like, so that we can start linking it, overdoses, we can start linking it to other social determinants of health that communities are struggling with, to, because I think this is how to get local governments, especially I'm in Western North Carolina, you know, we don't have the vulnerability of the Piedmont, but or the East, but we have, you know, terrible air quality days. So heat and air quality and humidity, we know, is going to put a tax on, especially young and older, pregnant outdoor workers, you know. So, but I think it's easy to say we're in the mountains, we cool off at night, we're not going to be as vulnerable, yet we know we have vulnerabilities here. And I think one strategy for elevating the conversation for local governments to prioritize it, because they have so much they're struggling with, right? They're doing as much as they can with the resources they have in many cases. But I think finding correlation for other things that they're already overburdened with, and how heat might drive worse outcomes, becomes a compelling argument to start implementing what's in your toolkit.
Ginger, I think that's a great point to bring up. One of the, at Duke, we have submitted a grant to actually look at the connection between heat and intimate partner domestic violence. A lot of that work, it's very sparse, I will tell you, in the US. In addition to thinking about how we better quantify some of those health outcomes associated with drug addicted populations. And there is some very early work, particularly coming out of Arizona, that is looking at the connection between opioid use and heat health outcomes. And so I'm happy to keep you in touch, you know, as that work develops. There really isn't a lot out there on these topics. And so it's why we have to continue to push and do these kinds of studies.
Thanks. And I
And then
want to add a follow-up to a couple of the questions earlier. So someone asked about recommendations for outdoor workers. So the toolkit does include a call-out section with resources on how to protect outdoor workers. And so even if, you know, if you believe the policies are not strong enough for your workplace or for workplaces in your community, there'll be resources to help you advocate yourself, or to educate yourself and to advocate for changes elsewhere. And then I also want to mention that we've worked closely with the North Carolina Emergency Management to build the Heat Action Plan Toolkit. And I want to mention that they are in the process of updating the heat annex in the emergency operations plan. So if you work in emergency management fields or any adjacent fields, to keep an eye out for that. And I think soon they're going to be collecting comments on those documents and how best to update them. And that document is specifically targeted towards helping local governments. So it provides instructions to the state government on how to support local governments during times of extreme heat. So keep an eye out for that as well.
A question came in asking about funding for cooling clothing, and Kathy, I saw that you replied. I had the same exact response, which is I don't really know, but I know NC State University's textiles, College of Textiles does work around this. I will say that within the Heat Action Plan Toolkit, we have tried where possible to include links that we could find to potential grant funding opportunities. Most of the things we've been able to find have been around like for tree planting funds or other types of more infrastructure related projects. I haven't seen anything around this, but just in general, we're trying to gather resources as we find them. And then another question came in about, is sun poison and or severe sunburns included in the health related issues that stem from high heat? I want to hand this to Sarah or Ashley, I think could probably give the most eloquent response.
Yeah, I think I'd like to respond to that via a question and answer response after the webinar so that I can have time to go refresh my memory on the specific case definition for heat-related illness, because it does include more than just heat exhaustion, heat stroke, heat cramps. And so I just want to make sure I give you an accurate answer.
Great. I think that those are all of our questions. I really want to thank everyone for joining and being engaged. I also want to thank all of our speakers today for giving your time and presenting and giving such great answers to these questions. I will open it up for any final thoughts and then we'll end the webinar. Great. Well, thank you all so much. We'll end it here. Like we said, the recording will be coming out. It will also be linked from the Heat Action Plan Toolkit website. Join the NCORE Resilience newsletter, and we'll be in touch with some resources. Thank you.